First up, there have been a lot of battles over what the school year will look like for districts around the state, but the latest state guidance has many teachers angrier than ever. The Department of Elementary and Secondary Education, or DESE, is calling for all teachers to teach from their classrooms, even when they're teaching remote sessions. Commissioner Jeffrey Reilly, no relation, I should note, said in a memo, quote, "Having teachers and critical support staff in the school will be beneficial to students, teachers, staff, and administrators because it provides more consistency for students and assures the teacher will have reliable internet access." And Reilly said it also allows administrators to provide better support for teachers and monitor the level and amount of instruction. But many teachers disagree vehemently. In a statement, the Mass Teachers Association said in part, "We reject the recommendation that teachers be required to conduct remote instruction from their school buildings regardless of safety. It is paternalistic and punitive and has no bearing on the quality of education that the real experts, the educators, provide so masterfully." I'm joined now by MTA President Merrie Najimy, along with Dr. Cassandra Pierre. She's an infectious disease physician at Boston Medical Center and an assistant professor at BU School of Medicine. Thank you both for being here.
Thank you.
Important topic. Glad you're talking about it.
Merrie, let me start with you. Why is the MTA's conclusion that these state guidelines are punitive and paternalistic as opposed to reflective of a sincere difference of opinion about what will make for high-quality remote learning?
Yeah. So, it's paternalistic because the commissioner lists all of the conditions that the educators need, when in fact it's the educators themselves who know the conditions that they need to educate children. Let's take internet access, for example. We've heard from so many educators on Facebook over the weekend, 25,000 educators in conversation, that their schools don't have reliable internet. And in the schools that do have reliable internet, they weren't built to have hundreds of class live streaming all at once. And in particular, the buildings, our big claim is the buildings haven't been safe before COVID. They're deadly now because too many buildings have been disinvested in. Public education has been disinvested in, and that's led to a lack of maintenance and upgrade in the ventilation systems, and the indoor air quality can't actually meet environmental health and safety standards in this very moment.
I want to go deeper into the safety issue with Dr. Pierre in just a moment, but Merrie, before we turn to her, your complaint about the guidelines and the reality that you're saying they don't reflect makes me wonder, to what extent was the MTA part of coming up with the state's recommendations for how the fall should proceed? Were you guys involved?
Early in the spring, when there was a task force put together by the commissioner, the AFT and the MTA had a seat, but it was 52 people. It was outside experts who had valuable information that came and talked at the body, but the expert opinion of the teachers were never asked. There was never the conversation about how do you take what the public health and safety experts just told us and make that practical or doable in the school buildings. We were in conversations with the commissioner throughout the summer. He unilaterally canceled our last set of sessions. So while we had a seat at the table, nothing was really considered and acted upon that came out of the perspective of the teachers.
Okay. Dr. Cassandra Pierre, as an expert in infectious diseases, when you look at the recommendations that the state has issued, what's your assessment of them? Do they strike you as reasonable? Do they strike you as risky? Maybe somewhere in between?
Probably somewhere in between. I think they need some more work. And the fact that people who are stakeholders directly involved in this process, like teachers, are not being sufficiently consulted about plans that affect their direct safety is problematic. And so I think that, even on a superficial level, just taking a look at these, I think they do need some more work. They need some more input from, as we just talked about, not just the public health experts, but the people who are going to be living this reality day in and day out. If there are going to be recommendations, for example, to have teachers do in-person teaching, regardless of whether it's an in-person or virtual day, there needs to be a critical look at the infrastructure, not just general language about this is how you're going to do it, but actually a look into each school to assess what the safety is, what's the ventilation, what are the areas that need work. We know that many of these spaces are old, have not been invested in quite some time, even by pre-COVID standards. And so we know that there are going to be issues with physical distancing. There are going to be issues with air quality. We know that there's going to be some flexibility, some creativity in terms of figuring out where instruction happens, even when the schools are not occupied. Not occupied at least by students. Other teachers and staff continue to pose a risk to each other. And so I would say that there are a lot of the plans need some work. And I would also say that the unevenness in between school districts leaves much to be wanted as well. We know that some school districts have thought through, for example, more specifically about testing, more specifically about creating transparent dashboards regarding infections in schools and teachers and children to allow community members, parents, teachers, and staff to understand what's happening at the school and how community level data impacts plans to continue reopening. So there's a lot of things that are missing and some things that are not implemented in each school district that leave me very worried.
That's a lot to think about. Thank you for the overview. Let me ask you both. I was having a conversation with someone after this story came out, and they said to me, basically, I'm paraphrasing here, I don't see what the problem is. If a teacher is teaching in their own classroom, you put on a mask, you make sure you have the proper protective equipment, you go in, you make sure no one's around you, and then, when you're done teaching, you leave. I'm wondering what both of you would say to this individual I'm alluding to. What's wrong with that take on this situation?
Yeah, so first of all, teachers don't just teach in their own classrooms. Middle school, high school, they share office spaces, often many to a small closed room. To teach behind a mask because you have to be in a classroom undermines the connections that you can make with our students virtually. We would be sharing bathroom spaces. You can't just lock yourself in your room as an educator. We have paraprofessionals who support the students. So it isn't as simple as getting an educator into a room for 6 hours in a day. And again, if the ventilation system doesn't properly bring in fresh air, all of the air might be venting from my room into the room next door to the next door. So anybody who may be asymptomatic but may have COVID and breathes into the air, that's just going to circulate throughout the building. Those are just a few examples of why it's impractical and unsafe.
Dr. Pierre, would you add anything there?
I completely agree with what was said. I would, say that those close contacts that will happen regardless of whether the rest of the school is vacated also continue to pose a risk. So in addition to shared bathroom spaces, there's also the break room, which is the bane of my existence here at the hospital because many people really misjudge the risk of others who are like them. So they may go in, have lunch with their colleagues. It's a long day. No students to actually interact with. People want physical interaction. They're going to go in the break rooms. They may take off their masks, eat together. We have seen a number of infections from that. In addition to that, it's not just the being at the school, it's the getting to the school. And so if people have to use public transportation, especially in hotspots or areas of higher transmission, that also puts them at a risk. And then beyond the safety, although that's not what this is getting at, I also wonder if there's a bit of an equity issue as well. Other people can work safely from home. At the beginning of the pandemic, many institutions ensured that there were safe connections, IT connections, that people could safely Zoom all day. And I don't see why that same shouldn't be ensured for teachers as well. That option, at least having that option.
And Adam, can I just pick
Merrie
on one
Najimy.
more point?
Oh, yeah, go ahead.
Yeah. So
Please.
What people don't actually realize, too, is that educators travel to their school from dozens and in some instances hundreds of different communities. In Revere, they live in 99 different communities. In Gloucester, 46 different communities. In Malden, over 100. So we're talking about the potential of widespread community transmission once the educators leave the buildings.
I think we are, well, no, we actually have time for me to sneak in one more if I shut up and ask the question. Merrie Najimy, is there anything the state could do, just briefly, that would make you feel better about at least a partial return to the classroom?
Absolutely. They have to have every single building inspected and certified to meet environmental health and safety standards. That means everything: air quality, running water, proper PPE. They have to have, we're calling for rapid, regular testing of all students and educators for free, contact tracing, and community, regional, and statewide transmission rates set and met. And I really appreciate what the doctor said: transparency in communication about those levels.
Okay, we have to leave it there. Merrie Najimy, Dr. Cassandra Pierre, thank you both for talking with us.